Teen Say.
Can you guys all say Team Say on 3? 1, 2, 3. Team
Hi, I'm Marianne, the producer of Dr. Libby's World of Medicine and Teen Say. The purpose of our shows are to give people a voice, hopefully a voice to make a difference. Today with me, we have a support group from POTS, and we're going to hear more about POTS and what these people are going through with a chronic illness that really devastates their lives on a daily basis. So, who wants to be the first person to tell us what POTS is?
I vote for Gina.
Tina?
The boss.
POTS, which stands for postural orthostatic tachycardia syndrome, is a chronic illness. It basically is many different symptoms to many different disorders. And POTS falls under the dysautonomia umbrella. So under this umbrella, there are many other autonomic disorders. So it's not just POTS, it's other things as well.
Okay.
So, I was just going to
Go ahead.
comment.
Oh,
So
sure.
what happens is the blood, when you stand up,
Uh-huh.
the blood flows down, and then it doesn't really turn around and come back up. So these kids always feel worse when they're standing, or really when they're sitting. When they're laying down, they feel better because the blood flow is even. When the blood doesn't flow up, they're not getting enough oxygen to their brain. They're dizzy. They're nauseous. They get headaches. They have no stamina because the blood's not flowing. It causes all other kind of symptoms. But we were talking earlier, if you look at their legs, sometimes,
I was
if
gonna
they
get
stand
there.
up,
Yeah. So
they're
let-
red.
So let me ask you something. So go ahead and show us your legs.
If you look at my if you look at my legs or even just my hands, even though I'm sitting, my blood is going to my legs and my hands. It's making my feet very cold and it's pulling. So if you can tell if I tap on it, you can see the white spots coming up. So I don't know how to explain it. The white spots are kind of I don't know how to say it. Yeah, it's like pulling the blood, but it's like making the blood go away from that spot. So that's how you can kind of tell it's like.
Do you all have that?
Yes.
Wait.
I have it as well, but with medications I take, it's controlled, or at least a bit more, so I can't show it now.
What medication do you take?
Oh, goodness. So many.
That's a really loaded question with us.
Okay, so we won't get there yet. We will, though, but not yet. Okay. So what age is the norm for someone to develop POTS?
Well, there's really no normal, and anyone of any age can develop POTS, but it is more common in adolescent teens. So anyone in their teenage years can have it, really. I know that it is more common in adolescent teenage girls, so.
So, go ahead. I heard somebody breathe. Yeah.
I was just going to say it.
So, I heard sometimes the puberty, concussions. I heard certain
A lot.
viruses.
A lot of times
We
I've
can't hear
heard.
you, so you'll need a mic if you say
Okay.
that. But go ahead.
A lot of times it's spurred by some traumatic event.
Okay.
Like if they go in the hospital and they have a big virus, and it's kind of like laying latent in your body, and it triggers POTS. So that's what you hear when you hear, oh, they got a concussion, and all of a sudden they have POTS.
So now we don't want to send everyone into crisis because
Right.
Lord knows every athlete
Right.
in Northern Virginia has 20 zillion concussions.
Right.
So why would we even put concussions in there? Are we saying it's coincidental or it's a severe, why would
There's just a correlation many times. That's what spurs it. There's also a big correlation with Lyme disease. A lot of Lymies get POTS. With Lindsay, we don't really know. A lot of times it's growth spurts that spurs it on. They grow too fast, and all of a sudden that they just can't function anymore. So there's a lot of things that can cause it. It's kind of, I won't say it's an up-and-coming syndrome, but it's something they're really just learning about now, and there aren't a lot of doctors who treat it.
That's what I've heard.
Yeah, I don't know as much as my my beautiful bride here, but what I understand, what I read, what I've seen at a couple of the conferences we've attended, it's a disease that's it's an illness that's hard to diagnose. There's not really, relatively speaking, there's not a whole lot that's known about it. There's very few doctors, probably in the U.S. specialists. You're talking of the order of magnitude of 100, 200. It's not more than that. So there's not really a whole lot that's known. There's not really a whole lot of money going into research, which is part of the problem in terms of diagnosing, understanding. There's gradations of the illness of the illness and syndrome underneath. It's not a one-size-fits-all. It's not. Well, obviously it's unfortunate. That's why we're all here talking about this. But hopefully, that the more people find out, through your show and through your YouTubes and other means, that it's going to get out there and will help other people as well.
Thank you. Well, they do a conference in July. They have a lot of speakers. When is that?
When is it? July? Yeah, that's in
We can
Herndon.
give it to. Do you want to talk about the conference real quick?
Can I just say one thing?
Sure.
One of the things with the illness is that it mimics, the reason it's hard to diagnose is because it mimics so many other illnesses. So it's not like you can go in and, they know immediately, because you might have, this person might have migraines and say, chronic digestive issues and, the lightheadedness and whatever, and somebody else might come in with some different ones. And it still is all, what it is a dysfunctional autonomic system. Okay. So, and your autonomic system is the thing that controls everything.
Right.
So that's the problem, but it doesn't affect everybody the same way. And one of the other things is that I said before that Epstein-Barr is another, that's a virus like mono. A lot of kids, if they've had something, and when you do have that, that stays in your body. It's another one of those latent. So then if you could have, say, some kind of traumatic thing, that can trigger. I mean, a lot of it is, at this point, a lot of unknowns. That's the problem, too. So they're trying to figure out what are all the connections.
I wanted to talk about this disease called POTS, which I called to ask you your expert opinion on,
Right.
because I had never heard of it. And apparently this mom said kids are getting left back in school. It's an awful disease. They get depressed, they have anxiety, and they're just not functioning. So I thought, okay. And I had the kids come down, and I promised them an interview with you to tell us more about the disease, because at first, as I said to you on the phone, it was like, well,
What is it?
what is it? Is this real? So can
That's
you tell
funny
us?
because you said, is it real? I do bump into pediatricians sometimes who ask me that same very question, is this real? Is it a disease? It's probably not a disease. The S stands for syndrome. Okay,
that's
so
the
it's
kids
more,
corrected me on that a few
so
times.
it's more of a syndrome, and syndrome means it's a collection of symptoms that put together can give you a diagnosis potentially. It's not really a test that you can do to necessarily pinpoint what this is, whether it's POTS or what causes it. Okay, POTS stands for postural orthostatic tachycardia syndrome. Okay. And you asked me questions beforehand.
Can the kids say that?
Well, they say POTS, and I think it was probably either a kid or a parent that came up with the name POTS, the acronym POTS, because in about 1993 there was a physician at the Mayo Clinic who actually started calling it postural orthostatic tachycardia syndrome. There was postural orthostasis before that, and the first really described in the late 1800s, but then called other things. And
Really? So it's been around that long?
it's been around because we've had an autonomic nervous system the whole time. It's probably been around since the beginning of time. We're just starting to recognize it. And maybe, as I think there's a lot of illnesses that we see today, or diseases, if you will, that you see today that maybe you didn't appreciate as much before because children and young adults died from illness. They died from, rubella. They died from diphtheria and polio. So now we have a large number of people that may have previously have been would have succumbed to some other illness who are now living, and we're seeing some things that we wonder whether they existed before. And they probably did, but we just didn't know, and we didn't have the way to study it. Okay, so yeah, it was first described according to Wikipedia. And that was a quick one that I looked at before I came over here to kind of tell you, maybe give you a time, because I didn't know. I was probably at Georgetown in 2002 or so, and somebody came to me and they wanted to know if they had POTS. And first thing I had to say was, okay, what does POTS what does POTS mean? And then they said postural orthostatic tachycardia syndrome. Oh, okay, yes, I know what postural orthostasis is, or what that is. But when I was in fellowship, I don't recall us calling it that. Okay, we definitely did tilt table tests and things like that to look for people who had orthostatic hypotensive symptoms. Okay, so the definition of POTS, postural orthostatic tachycardia syndrome, means when you sit up or you stand, and you stand for about 10 minutes, you have at least a 30-point increase in your heart rate over that 10-minute period of time. Okay, your blood pressure usually stays stable. Okay. So you're not one of the fainters. Okay, so fainting is what you hear the term syncope. Okay, so there are people who have syncope illnesses, and there are people that have POTS, and they're in a spectrum of disorders of dysautonomia.
One of the issues is education, people knowing, whether they be doctors, patients, caregivers, school systems. We had a discussion at one of the Fairfax County yearly meetings, and one of the issues is, and I think you guys that have kids in high school are even more familiar, that some of the administrators, when you go in and you say, well, my kid has this kind of problem, they're like, really? That's part of the problem. So
first of all, we have to all thank Christine, because Christine and I were in Lowe's and I was complaining I had a headache, and we were just talking while we were at the pain counter, and she told me all about POTS, so thank you, because I wanted to help you guys have a voice, so we could help you guys with some awareness. And basically, the motto of Teen Say was always where teens could have their say and adults couldn't see where they're coming from. But in this case, and I heard some of you say normal, you said, what did you say when you were sitting down?
I don't remember because I have brain fog.
Here in this group, you said you felt normal, and I chuckled, and I thought that was really sweet, because that's what we want to do on Teen Say. We want to help you feel normal. We want to help you have a voice, so you can talk about whatever is bothering you. And you are normal with peers that have exactly the same thing, so you all need to connect and make friends in your support groups like your parents are doing, and hopefully that'll be better.
We need empathy, okay, from the caregivers. We need to, these kids can't be made to feel like they're faking it. Okay.
Yeah, that's
because
rotten.
Well, you
when
get
they have something nobody understands, and they
right, and then these kids have
and then their moms and dads are strong advocates, and
right.
then they feel beaten on too, because here they are trying to help their sick child, and
but then
no
the
one
kids
takes
feel,
them seriously, or the child seriously.
The kids feel like they're being, so much attention's being paid to them. They don't like that.
Yeah.
Okay. They don't like being the person in the family that's making them not be able to do things, just like the other kids don't like the fact that they can't do this. And you may get families who will say, because of you we can't do this, and that hurts. So you can't have that happening. And so these kids will have
therapists,
psychological problems. Many of them don't, because they're like, I'm not crazy, doc. So you have to get to them and say, yeah, you're not crazy, but you've had this chronic illness. You have to be affected by this. You're a teenager, okay? You're going through lots of changes in your life and in your body anyways. It's got to affect you, okay? So they may be
to talk to somebody.
right. They may need to be on anti-anxiety medications. They may need to be on antidepressants, and some of those medications actually help with some of the kids with POTS.
Tell us your story.
Well, when Maddie was 11, it was in 2014, she woke up with a really bad stomach virus, and
Which is rotten as it is.
yes, and it was bad. It was very severe, much like a 3-year-old would have. And she was upset, and she continued to be sick. And we knew for sure it was a virus because a friend of hers, they had both eaten at a couple of the same places. It wasn't any type of food poisoning, but it had definitely been a virus. They had eaten in the same places over the weekend. She got sick about 10 hours later.
Okay.
She was better in 2 days. We were going back and forth to our primary care physician, continuing to try to get some relief. And she would seem to be fine during the day, and then she'd get sick at night. And she could eat whatever, At that point, we weren't letting her eat anything that she wanted, but she could have. Now we know. So we
Do you
finally.
remember this? It was terrible. Okay. So you do remember? Okay. We're gonna come to you in a minute.
So she continued to be. It happened on Veterans Day of 2014, and she continued to be out of school. And finally, the Sunday before Thanksgiving. It always seems to be around Thanksgiving when she gets pretty sick. But right before Thanksgiving, we ended up in the emergency room. They did a brain scan because she had a horrible headache because she was dehydrated. So then we got in to see a wonderful gastro doctor, and the gastroenterologist did all kinds of tests and said, I think that it's slow emptying stomach, which is gastroparesis, which is part of the autonomic system. And sure enough, that's what it was. And we did some medications. There's really no cure for it, but there's a lot of things they can do to help it out. So over the course of time, she was, getting better. But each time she would get a cold, she would get this stomach thing. And it was pretty unenjoyable and something that's really difficult to go to school with. However, she did go to school with it with the help of her very good teachers who were very understanding. And
What grade was that?
that was in her 6th grade year.
Okay.
And so then things started to seem to be so much better. But last year in January, which this happens very often, she thought she was having anxiety attacks because she wouldn't be able to get her breath, and she would feel out of place when she'd be out in the hallway. And what was happening was she was sitting in class, she would get up and start to walk, and Maddie's is the type where she passes out, which she did not know that at first. So over the 6 months, I kind of went, there were a couple times we had to go pick her up. Twice she did pass out, and once she almost did. And I started kind of linking it up because it would be after lunch and either right before PE or right after PE where she had the exercise. So over the summer, she was doing something she loved. She was at a camp that was not strenuous, and she went in and they called me. She had passed out, and I did all the things. She wasn't dehydrated. She'd eaten well. She was not stressed. She said, Mom, I had an anxiety attack. I said, what were you anxious about? Nothing. So the therapist said, this is something more than anxiety. So we saw the doctor, and he said, I think I know what it is. Primary care physician, and he was great. And he said, I think I know what it is. I have athletes with this. And he said, they're fine one day, and then after that, they can't compete. And so we went through the process, and that's what it was. And then she continued to be sick. That was in September of this year. She got really sick with just like a virus. She got a headache, which the kids get. And she had a migraine that just would not go away. And then she started passing out. And when she went into the hospital, she was passing out 10, 12, 14 times a day.
Wow.
And she would, even just sitting still, she would eat and pass out. And the day that we took her to the emergency room, well, we checked her in to the emergency room, and then she was in for a few days. We thought we had her straightened out. She went back. The day that we took her to the hospital after we'd consulted with the cardiologist and the gastro, he had come home to help her with her lunch, and we were getting things prepared to go to the hospital. And he had made her soup, And he was standing there and he looked over and she was face down in her soup and a big bowl. And, you know, it's pretty serious. And she was passed out for, that time wasn't that long, but she was passing out and staying out for a little bit longer. And the whole reason was she had gotten so dehydrated from being so sick. She wasn't holding that water in. And so now we're at a new normal, but she goes to school, she passes out at school, they take her blood pressure and her vitals. If she feels like going back to class, she goes back to class or continues if the nurse comes down to see her. So it's pretty tough. But
So they understand. They're being understanding.
yes.
More or less.
Yes.
Okay. We're going to get into the school's not understanding. Believe it or not, they had that for a long time with concussions. We did a show with Head to Head, and then they had to get very involved. Now everybody understands concussions, so there's hope for you guys, okay? So tell us what you remember about Mom's story,
Well,
or what you remember about getting this disease. One day you were normal?
we went to a couple of places with my best friend Alyssa, who I grew up with, and it was great. I was so happy. I was being perfectly normal and
You're still normal. You look great.
being perfectly averagely normal.
Okay, averagely.
And
See, now you're special.
and the next couple days we were both out, and now every single time I'm sick, she gets sick within like 24 hours, which is insane. But but the first time was miserable because I'd never experienced something like that. Like when
was the first time, like when you first passed out? Like, do you remember passing out?
First time I passed out, I barely remember it.
Right.
But I mostly just remember the scariest ones because there are a couple times. One time I literally toppled down the steps. There was one time half of my body was down the steps. Then there was a time that I passed out in the shower and just like in the cartoons where it's like they kind of like, like those rides where they just kind of, slowly get to like the bottom, but first they rock back and forth. Like that's what happened. And I had terrible back pain. It was terrifying waking up in the tub and being like, oh my goodness, I passed out. And
So you came back to
Yeah.
before anybody knew you were in the shower passed out?
no, they
You hear her.
Okay.
We would sit and listen and listen for a thunk. And she's not supposed
Oh, wait. Sorry.
She's not supposed to stand in the shower.
Well, now we
And
know this, but we didn't know this back then.
We did. It was before we got to that point
Yes.
that we thought we didn't realize. But
Yes.
yes, so she does not stand in the shower anymore. She
I thought you wanted to say something.
Yeah, I
and
would
then
say
was like, what?
part of this is it's mostly about them, but obviously as parents we're all affected.
Of course.
And part of our life is we sit all the time now. If we're sitting and watching television and she's upstairs getting ready for bed, we listen for the thunk. And if a drawer closes, it's are you okay? Or we run up the steps.
It changes things.
Now in the middle of the night, she has to call us before she gets up to go to the restroom because we're afraid of her passing out in the middle of the night and not knowing that she's passed out. So not only, getting a good night's sleep is sometimes a little tough because these kids don't sleep. At least have a very hard time going to sleep. Although they're very tired all the time. So, we get, it's gotten a lot better, but, and her sleeping patterns have gotten better. But for a while, it's, you were called every 45 minutes that I'm getting up to go to the bathroom, that kind of thing. So,
Okay, yeah, we're going to hear about, so now we know we have to hear about the frequent trips to the bathroom, the frequent water and tough times.
Oh, yeah,
in the
water's
school.
definitely part of it.
All right, let's hear everybody else's story, and then, so let's hear yours, Christine. I heard a little of it, but we need,
Yeah.
the viewers need to hear it, too.
Looking back now, I think things started a lot sooner. Even pretty much since he
And
was
who was
born.
your son?
Andrew, which I have
Andrew.
we were joking before, I was commenting, they say 75 to 80% are female.
Right.
We have 75% female, my son. So perfect statistic for this.
Well, thank you for doing that. That's Andrew.
Yeah, we planned it that way.
Yeah.
But the POTS journey for us, and we didn't know till 3 years later, started around November 2012 when he was 11, which I think is a common age, although it can start. I think there's people on the board like 7 or 8 year olds.
Wow.
People can
Yeah.
be a lot older. But anyway, he started out,
I
he
heard
was doing
puberty was
taekwondo.
yeah.
That was puberty. But he started out in taekwondo. Doing the spins were getting him dizzy. He would get headaches. He was getting migraines every month, the same time of the month, 4 or 5 days. He would be out of school. We didn't know it was a migraine at the time. Started taking him to the doctors. Found out he had walking pneumonia, I think, initially. Then that got cleared up, but it wasn't going away. They're like, well, just drink more fluids. You know, this age, a lot of them get dehydrated. Just drink more fluids, which he did. Found out he had testing done, got diagnosed with reduced vestibular response. Can't do anything for that. Was told, just need to live with this the rest of your life. And at this point, he was dizzy all the time, had a headache all the time. Was on Topamax for the migraine, so those were being taken care of. It kind of pushed the headache and the dizziness to the background to where he could deal with it. It was there, but didn't interfere with his daily life. Then spring of last year, 2015, he told me the dizziness and the headaches were getting stronger again, and he was still on Topamax, so went back to the neurologist. He said it could be because maybe he didn't need the Topamax anymore after 6 to 12 months if he haven't had a migraine anymore, which he wasn't. You can go off. So, and if it doesn't go away, he referred us to an ENT that specialized in vestibular and balance issues. Took him off, didn't go away. ENT said he thought it was POTS, referred us to Dr. Abdallah, got the diagnosis in November 2015, right before Thanksgiving. Shortly after that, and after Thanksgiving, December, he started getting worse because he was still functional at this point. But then he started getting worse, started missing a lot of school. And then I think around January time frame that year, was it 2016?
You guys don't have to be exact with dates, just, yeah.
I'm just trying.
Yeah, no, just so you don't worry. Go ahead.
But he started having like the stomach hurting all the time. He was nauseous all the time, chest pain, everything on his body hurts. I mean, everything hurts.
Okay. You want Andrew to talk for a little bit, give you a breather? In a second. Here you go, Andrew. Why don't you tell us a little about when you realized you were getting sick and things weren't functioning normally, or like they were. Now you have a new normal.
Honestly, I can't remember a whole lot. I remembered all the headaches, the migraines I used to get. And I remember when I had first gotten sick, after that had made everything worse, I had just gotten back from a trip to Thanksgiving, visiting my cousins. And then I had gotten sick with something that was going around at the time. Was it a thing that normally lasted 4 days or something? And you had it too, but I lasted.
Like a stomach flu?
It was some virus.
Yeah, some sort of virus. But I had it worse, and it also lasted a couple days longer than my mom. And then after that, I just kind of never felt good, or at least what my good was, because already at the time with the dizziness and the headache, that wasn't normal, but like I'd gotten used to it. But after that, it just got a lot worse.
So you don't go to school right now?
No, I can't.
How old are you?
16.
Okay.
I'm in 10th grade.
10th grade. So you stopped going to school when?
Well, in 9th grade last year, I got about halfway through the school year, I believe. No, not even halfway. Almost halfway.
Okay.
And I got to the point where I couldn't, and then I believe at the end of the school year I kind of was going back partial time.
Okay, so you're doing homeward bound now?
Yes. And then as for this year, I made it about 2 weeks into school, and then I couldn't go at all, and I haven't been feeling any better, so I haven't been able to go back.
If you had to sum up POTS, you would say that it's an awful syndrome, but that you try and get them as normal of a life as possible, and hopefully,
we want to get them back to a sense of normalcy.
and hopefully they'll
Hopefully we'll outgrow it. Hopefully they'll outgrow it, or they may need medications for a longer period of time. Many of them will outgrow it.
So
It
how
is
many
a
years do they
real
usually
problem.
have it?
It varies. If you have somebody, I don't think there's any statistics that would say if you have it come on at 13 that you're more likely to have it until you're 25. I don't know that there's that statistic out there.
Most of the time they develop it around puberty, though.
Puberty, right? Puberty, growth spurts, things like that, and it is something that generally we feel gets better. Is it genetic? I was mentioning earlier that there may be kids who, if they really are wheelchair bound or something like that, they may have a mitochondrial disorder, and therefore we may need to get genetics involved. They may have Ehlers-Danlos syndrome or some form of connective tissue disorder where they have loose joints, and that's often seen with these kids.
Lisa, your story was pretty interesting because you were older than most. And how old are you?
I'm 25.
Tell us about that dream job you had. I'm so envious. Where were you working?
I finally got my dream job as a photographer at Walt Disney World.
We were singing Be Our Guest before, right? Anyway, go ahead.
We can continue if you want.
No, singing? No.
So I was there having the time of my life, and then I guess POTS came along and decided to change that up a little bit. I was fine.
First?
No, I was like normal, and then all of a sudden I just like woke up sick. I guess I started out with migraines, and they just kept getting worse, and I went to urgent care like 3 times, and they just kept telling me it's just migraines, no matter what I would tell them. And then I would like call my mom from work and be like, I feel like I'm gonna pass out. I'm in my car. I can't even walk to like where I'm working. Like I can't drive. Like, do I go to the emergency room? Like, does that even work in Florida if we don't live in Florida? Like, I don't know what to do. So that kept happening, and then it just kept getting worse, and I would get more symptoms. And finally, after calling out sick for I don't even know how many days, it was like over 12 days and 3 months. We decided that I should probably come home because we knew of specialists and things, and I couldn't keep going to urgent care because they were just going to tell me it was migraines and give me some more pills that weren't going to work. And if I couldn't work, then I couldn't pay rent, and that was just a problem.
Yeah.
So
problem.
I came home, and we went to a primary care doctor. And while I was sitting, she took my heart rate, and she's like, have you ever had heart rate problems before? And we were like, what do you mean? And she's like, it's like 140 while you're sitting.
Wow.
And we're like,
Wow.
okay, well, we definitely have not had that kind of a problem. And then so she said definitely to go to a cardiologist. So we went to a cardiologist. The first one we went to definitely was not a helpful one. He at least said that it was probably postural orthostatic tachycardia syndrome. So at least then we had a name to go home and start looking things up. But he basically said there's no cure. So come back in 6 months, have a nice life. See ya.
Wow.
So then we went home and did our own research, and we were lucky to find Dr. Abdallah, who happens to be like 10 minutes from our house. But he does pediatrics, so we weren't sure if he would see me. But I guess my mom like begged him or something, and he said he would see me. But it was still like a 6-month wait, or I don't even know how long. It was a long wait. But when we finally got in, he did the tilt table test. He did a Holter monitor. He gave me beta blockers. And then after that, I needed more than just beta blockers, so I tried like a whole cocktail of other pills that didn't work until we finally found the right combination. So
That's hard because some medicines hurt you
yeah,
while they're trying to help you.
yeah,
and
like
you
some
have
of the
different
symptoms are worse than the
reactions.
disease, the illnesses themselves,
Yes.
or they don't work with each other, and then you also get diagnosed with other illnesses on top of that. So then you have to work with that also.
So tell us about the lemonade that you made out of the lemons you were dealt with after not working for Disney Can I have mom and dad stand up? Can the cameras take a look at mom and dad? What are you wearing? Stand up, Nisa. Can I have the mic? Oh, no, you hold the mic. Tell us what you're wearing. Oh, you put on my favorite. Tell us about this.
So I was sitting at home and I wanted a way.
You can also, sorry.
I wanted a way to continue making art while raising awareness, because I noticed that there was not very much awareness out there for our illness. And no one had any idea what I was talking about. Some doctors didn't even know about the illness. And we just needed more awareness. So I started designing awareness apparel. Not just for POTS, I do it for all chronic illnesses. So far I have like 1,000 designs representing over 100 illnesses.
Awesome.
So I have a goal to one day have one design for every illness, but that's going to take me some time. So.
Good. And so you're able to work still at home and doing this. So
Yeah.
you're able to get some functioning time. You're all able to get some functioning time.
What do you mean by functioning?
Well, so you're designing.
Yes.
You're drawing. You're right
Yes. But yes.
on the couch.
And
but
I
that's
have to take a nap.
functioning. You're functioning.
But she's not able to hold a full-time job.
Whoop.
She's not able to hold a full-time job. She's
She's
not.
a designer. She's
Yeah,
designing.
yes, but I mean,
Some designers work in their pajamas from home.
right. She's working from home on the.
Newest thing, right?
She's working from home on the couch.
Yep.
She's it's nonprofit, so she's having all the profits go to different dysautonomia groups, which is great. But the problem
Maybe
is
she'll start making profits someday.
the problem is she's 25, so she won't have health insurance soon. She only does this a few hours a day because then she needs to have a nap. She needs a couple hours nap, even though she's sitting on a couch and not running around, because she becomes exhausted. So it is great.
What happens if you try and push it? Let me give one of them the mic. What happens if you try and push it and go for a walk? Like some athletes will say, oh my gosh, I hurt my leg yesterday, but I'm going to try and jog today.
I think it depends on the day and how well we're feeling, but if it's a bad day, like really bad, and some days we can't even get out of bed. Okay, on a good day, hopefully some of us will be able to most likely make it to school. I'm on a modified schedule and partial homebound, so I'm only there for 4 hours. I don't know how many hours.
Right, but you said you're going to school, what, 9 to 1:30?
Yes, I'm going from 9:30 to 1:15. I try to go every day, but really you can't say, tomorrow I'm going to go to school, because you can't count on it. You have to play it by day.
How do you feel when you're walking around school? Does it make you feel better?
No, our main hallway is 1/4 of a mile, and just walking that is very hard. By the time I get to the end of the hallway, I'm out of breath. I feel like I need to sit down, but I can't because we have a large population in our school, so you just have to keep going, and you can't stop until you get to your class, really. But in our school, I feel like you have to try to know your limits. We have to try to push it until we know we really need to stop. So for some of us, we take naps, or for me, I can't take naps, and so I can't do that. But I know once I get home from school, I have to go lay in bed, even if I feel like I feel great. I have to go lay in bed because I know that the adrenaline rushes I get will go away, and I'm going to feel really bad afterwards. So if you push it too much, you're going to pay for it in the days afterwards.
So they were a little frantic on the water and going to the restroom. And so I was like, okay. And then a couple of the moms made it seem that this was obviously very overwhelming to the house, to them,
Right.
to the kids. And it sounded very much like they didn't think they were going to get better. They weren't ever going to have a normal life.
There's maybe an illness, okay, it may be a surgery, some form of trauma. So a car accident, okay, could be a trigger.
Okay.
A broken bone, different things like that.
Little things like that?
Little things like that that we don't fully understand why they are,
Right.
but they can be triggers, some form of trauma, okay? Along with illnesses
rare.
like mono, okay? Illnesses like Lyme disease, other, illnesses that tend to lead to sometimes chronic fatigue types of symptoms. And that's one thing I didn't bring up as far as one of the symptoms. It's many times it's debilitating because of the fatigue. The fatigue and brain fog, I think, are some of the things that make this much worse for people to tolerate, okay? And if you have, let's say you came from a family of 5, okay? If you have one kid that can never get out of bed, can never do this or that, yes, it affects the entire family's what they can do, unless that kid just gets up and does it anyways.
But they can't.
Some can. They may decide not to. Okay.
So can you push them?
Can you what you
motivate
want to
them?
do, yeah, I think you can. I think what you need to do, these kids need to get up. They need to get moving, okay? Problem is, and this is where the various spectrums of disorder is, you have to target the thing that is maybe the worst part of it, okay? If the fatigue is, or if they're always tired, you have to get them sleeping. You have to fix that problem, okay?
Right.
If it's a big problem with fatigue whenever they try to exercise, then you have to work on that, and you have to work on that gradually. But long periods of inactivity make it worse. Okay, so you have to get them moving, and you have to get them into a exercise program. And there are various exercise programs that are starting to come online a little bit more for this. There's a Dallas exercise program that was created, I think, by a doctor in Houston, actually, but it's called the Dallas Protocol, that involves over maybe a 3-month period of time a build-up in exercise, starting out with more supine types of exercise, so rowing machines and recumbent bikes and things like that, and eventually getting into more of a lower body sorts of workout, and eventually getting into more of a cardio type workout, so if they can tolerate it. So you have to get them moving, you have to get them exercising. The staples of treatment that are non-medicinal for this are sleep, hydration, nutrition, and exercise. Okay, if you can get them doing, if you can get all of those parts going, you're probably going to get more in line with a cure for it.
So can you tell us, I'll give you this.
Sure.
Can you tell us a little about
Lindsay's story.
Lindsay's story?
Yes.
Thank you.
Well, I think you have to be a mama bear when you have kids that have this illness. I never thought I'd be sitting here doing this. I never thought my kid had a chronic illness. I just knew that she never felt well. We've never gone anywhere without, and this isn't to hurt your feelings, honey. She understands. But, we've never gone out to dinner without her getting there and sitting down and saying, I feel nauseous. We can't go on vacation because, she would always be so tired. We just couldn't figure it out. And
What
then
if she was in a wheelchair?
I think, with invisible illnesses, that's the problem, is these kids look normal and they're not. And they're really suffering. Yeah. I think if they, had their arm in a cast or they were in a wheelchair, people might be a little more understanding.
Would that wheelchair help if they got
Sometimes it does. But then, you know what? We talked about her bringing her cane to school. And I said, what I worry about is if you're having a good day, and you don't have the cane, then the kids are going to give you a hard time and say, well, what? You had a cane yesterday. What's wrong with you?
So who cares?
People don't understand, and kids are very cruel.
They are.
So invisible illnesses are very difficult.
Again, and I don't mean to repeat this, but again, same thing with concussions.
Yes.
And they had the same battles. If you watch our concussion show on Teen Say, you will see.
Yes.
We had a very similar battle, getting the awareness out there,
Yeah.
getting the schools to respond, and knowing that cognitively they were not functioning, and you can't put your brain in a cast. So there's hope, okay?
There
There's
is hope.
Yeah, we'll
There
just
is
keep
hope.
speaking out. You have the conference in July.
Mm-hmm.
There are going to be some great speakers,
Yeah.
and I'm sure all these great speakers and great doctors are going to help you guys with the awareness, especially if Hopkins is working on it, right?
Yeah, just as far as Lindsay, and I'll be brief, but we did go to doctors for years, probably ever since she was in 2nd grade, because she's never felt well. And progressively, she missed more days of school each year. We went from 12 to 24. She's probably up to 45 to 50 at least this year.
Wow.
So they miss a lot of school, but you have to have.
She's going.
She is going, and we've finally gotten to a point with the modified schedule and the part-time homebound that it is working.
Awesome.
But you have to jump through hoops to get there. So that's part of the challenge also. You go to a lot of doctors trying to figure out what is wrong. You question yourself. Is there something wrong with her mentally? Is she having anxiety? Is that why she's not going to school? Is somebody bullying you? You go to every depth you could possibly imagine trying to figure out what the heck is wrong with your kid. It's so frustrating.
Yeah.
It's frustrating for them because nobody believes them.
Yeah.
It's frustrating for us because we don't know what to do next.
Yeah.
You're on the internet and you're just looking around trying to figure it out. It's very
Sad.
challenging.
Yeah.
But we've had her scoped and we've done MRIs and
She looks great. Look at this happy smile.
You can't imagine all the tests this kid has been through to try to figure out that she has POTS.
This one too. They're just
They're making
happy kids. They're
yeah.
kids. Kids
Yeah.
are resilient.
They're making progress.
So tell me about the cure. Can there be a cure? Is there a cure?
They say that sometimes the kids outgrow it, which is all
Did you hear that?
what we can hope for. We know a boy that she went to school with, and he was in a wheelchair one day from a virus, went in a wheelchair, and now he's on the cross-country team.
What?
So he is
Wow.
amazing. He's still on medicine.
Okay.
Right.
So you're going to follow up with him, his
Absolutely.
parents.
absolutely. They're friends now.
So
yeah.
we need to talk to him.
He's fabulous. Yeah,
Okay.
he's amazing.
We need to talk to him. To figure this out.
So sometimes people recover from this, but sometimes, they're on medicine for their whole lives.
Which is okay if
yeah.
advised.
They start out kind of in the young
I
teens.
do have a question on that.
Young teens through, I had a 19-year-old college student who came to me she thought maybe she had POTS. Now, I think she has a dysautonomia because she's fainting a lot. When POTS, usually you don't get the fainting. But she's had this since she was like 4.
Wow.
Okay, so she's had a problem all along, and many of these kids get better.
They do.
Many of them get better. Most, that's variable as to who's going to get better and how many get better. Some have said up to 75% of people will get better. It may not be that high. It may be because there is an adult population of people with POTS.
So we're running out of time. Before we close, I want to hear from you guys because this is Chinsei. I want to hear, and thank you all for being here and for sharing your stories. Sure, you're welcome. And I'm praying for all of you, as everybody out there will. What you said was great. I'd like you all to leave us with one statement for any teen that gets diagnosed with POTS and tell us what you would tell them. Andrew, we'll start with you.
Many words.
Come on, Andrew.
I guess just that there are others out there who have this and that you can get through it and it can get better. Yeah.
Okay. Nisa?
Just don't give up. You'll find your people. I found plenty of awesome people online. And like others have said, it's a horrible illness, but you find plenty of wonderful people along the way.
It's awesome.
A lot of people will be mean to you about it and comment rude things or about you and just they won't understand, and most people never will, because to others you look like a healthy person unless you have a cane or a wheelchair or you're in crutches. But just don't or try not to let those comments get to you, because
there's a support group out there to help them, huh?
Yeah, but we have to try to learn to put up that wall that we did not cause this, that it is not our fault, and that we can try to learn to live with it. If we outgrow it, great, and if we don't, we will still learn to live with it and get on with our lives and learn how to get through. But we can't take every mean thing or everything someone says to heart.
That's good advice.
You did nothing wrong. Don't stay up late at night and ask, why me? Why did this happen to me out of all people? You know, it's not anyone's fault, and you can't just, don't take it out on yourself, because it's something you can't control. It's out of your reach, and all you have to do is find people like you, and like, you know, support groups are a thing, like you guys are saying, and meetups are a thing, and you meet some great people, like some wonderful, genuine people that like you didn't know could possibly exist, like how amazing they are. It's wonderful. So just keep a positive mind and know that things will be all right in the end, even if they aren't normal, you know, there'll be a new normal, you know? So.
Great. Well, thank you all for being here. And we want to help all of you out there. If you need a voice, if you need to be heard, and you want to make a change, Teen Say, email us and we'll get your crew together. Thank you all for being with us.